Hey friend, welcome to Translating the Label podcast for hairstylists. I'm Anna, a hairstylist with a passion for cosmetic chemistry. This is where we dive into the real details of hair care beyond brand hype and brand narratives, giving you an industry insider's insight to cut through the noise and enhance your expertise. You're not here to hear what you want to hear. You're here to stand out as a stylist with a deeper understanding of the hair care industry.
Today, we're going to talk about how professional hair care products can assist with hair loss issues and what are the realistic expectations we should have when it comes to professional hair care products. So the first thing you need to know about this is that the vast majority of our products, when it comes to professional hair care, they specifically state that they promote hair growth. And promote is not the same thing as regrowing hair. So promote means to encourage, right? They encourage hair growth. Now, the reason that professional hair care products can only encourage hair growth is because they're regulated as cosmetics. But there are products that do regrow hair. However, these are regulated as drugs. So drug products, we know them because either we got a prescription from a doctor and filled it at a pharmacy, or we got OTC, which is over-the-counter products, and OTC products have the drug facts label on the back. So that's how you know you're buying a drug product, is because it specifically states it, or you picked it up from a pharmacist. So cosmetic products, which are the vast majority of professional hair care products, they cannot penetrate the skin and they cannot create a change to the body. Now, this is a legal requirement pretty much worldwide, is that cosmetics are not allowed to penetrate into the bloodstream and they are not allowed to create a change to the body. I just wanted to reiterate that because it's very important to know the distinction between the two. And it's also important to know that this isn't just something that happens like here in the US. This is something that happens worldwide. So the next thing we need to know as hairstylists to best assist our clients is we need to understand the skin. And I know that you most likely already know most of this information, but there's probably a few like key details that we're forgetting or we just simply don't know. So the first thing we're going to go over is the layers of skin. So it has 3 layers. We have the epidermis, which is the outermost layer responsible for protecting and waterproofing the body. It's important to know also that our skin's function on the body is a barrier, not a sponge. Hence, the waterproofing, which is why you can take a shower or a bath or go swimming without, absorbing all of that water and like blowing up like a balloon. Okay, the next layer of skin after that is the dermis. So this is the middle layer, and this layer is where the blood vessels, nerves, sweat glands, and the hair follicles live. It's super important to understand that the hair follicles and the blood vessels live in the dermis, in that middle layer. Okay, and then after that we have the hypodermis, which is the sebaceous tissues. And I may have said that wrong. I'm so bad at pronouncing words. Feel free to laugh along as I butcher them. But anyways, so the hypodermis is the deepest layer, and it is composed of fat cells, connective tissues, and it provides insulation and cushioning for the body. All right, so let's get a little bit deeper with this epidermis. So of course there's the layers within layers, right? So the stratum corneum, this is the outermost layer of the epidermis. And this is basically like the skin's outermost covering. This layer is a thin translucent layer composed of dead flattened cells. Now, the function of the stratum corneum is it protects the skin from external factors such as water loss, UV radiation, and chemicals. So it's also important to note that the stratum corneum is an actively shedding layer of skin. So when we apply like hair care and other cosmetic products to our body or to our skin, we are applying them to an actively shedding layer. And legally, our products cannot penetrate past the stratum corneum. Whatever, I probably said that wrong again, but that's okay. So I know that marketing always makes it sound like our bodies are absorbing everything that goes into them, and that's true, but they're leaving out the fact that it's really only absorbing into the outermost layer of the outer layer of our skin, which is actively shedding off of us at all times. So think about that and like take it in for just a second, right? That's a little bit different from it going all the way through the epidermis and getting into the dermis where the blood vessels are. Okay, so beyond this, now when we think about how we are applying a lot of our hair loss products, again, this is going to the outermost layer of our skin, right? Like when we start with shampoo, that's applied to our scalp and hair and it's massaged into, or I shouldn't say into, it's massaged all over our scalp. And this cleans the scalp of any oil and debris. But it's not actually reaching into the dermis where the hair follicles and the blood vessels live. It's just surface level, right? Now, it's still really important to keep the scalp nice and clean because we want to make sure we're removing all of the oil and debris so that it's not clogging the follicles and preventing new hair growth from emerging out of those follicles. Because if they get clogged, that can and absolutely does happen. It's not necessarily happening to everyone who's experiencing hair loss, but we want to keep that pathway open, promoting or encouraging those new follicles to emerge, right? Again, back to that word promotes, which doesn't guarantee. Now, I should also say it's important to note before we move on, if you have a client who is experiencing hair loss issues and is concerned, you should always advise that they reach out to a medical professional. And the normal pathway for getting help when it comes to hair loss is to first talk to a PCP and then they will typically refer you to a dermatologist. You could also ask if they could refer you to a trichologist. So dermatologists do cover hair loss and scalp issues, but they also like do the entire, like all of your skin, whereas a trichologist specializes in hair and scalp. So a trichologist, if possible, would be amazing, but dermatologists are very helpful. So either one of those is great, but we are not medical professionals, so always advise that they seek out medical professionals. Okay, now the next thing is a lot of our shampoos, you may have noticed, when we apply hair loss shampoos to our scalps, they will often feel like minty or tingly or something along those lines. And this is because they're stimulating the scalp. And anytime we stimulate the scalp, we promote or encourage blood flow to that area. Now, when you get blood flow through the area, blood flow is what feeds the hair follicles, right? And that is, so basically the blood flow is delivering all of the nutrients and whatnot that the hair follicle needs to, of course, stay alive, but also to thrive. So any type of scalp stimulation, which, well, I mean, as long as it's not hurting you, but most of the time it doesn't. Any type of positive scalp stimulation encourages hair growth. So that's typically what a lot of these products are talking about when they say promotes or encourages hair growth. All right, now beyond that, a very recent trend that is gaining a lot of speed and traction is the skinification of hair and scalp, right? A lot of scalp care products are really starting to we're getting more and more of them every single day, which is great, especially for people who are tackling hair loss issues. So any products that your clients enjoy using and encourage them to use regularly or consistently is what we want for them, okay? So that could be a scalp exfoliator. It could be a scalp oil. It could be a shampoo that they really like using. It could be conditioners, like anything that gets them stimulating the scalp in any way is good. So another way of stimulating the scalp is honestly scalp massages. So when they are shampooing their hair, even though they have that tingling shampoo, still you want to encourage them to leave it on for like 2, maybe 3 minutes and massage their scalp the whole time. And then maybe when they apply their conditioner, also encourage them to do a scalp massage while that's on. They could also, again, use like scalp oils or scalp exfoliators. But the more that they love their routine, the more consistent and more apt they're going to do it. And that is the biggest tip that I can give you to get your clients the absolute best results with cosmetic products. So it's not the products themselves that are doing the magic. It's the stimulation that they get from using those products that is doing the magic. And of course, if they want that guaranteed hair to regrow, absolutely seek out a medical professional, consult with them, and maybe you would be or they would be a perfect candidate for, some kind like a drug of whatever kind, that would help with that. So I hope that gave you a deeper look into hair loss and hair growth so that you can help your clients and get them the absolute best results possible. And as always, if you have any questions, please let me know and let me know what you would like to learn next.
As always, I would like to take a moment to recognize that the true experts when it comes to cosmetic chemistry are the cosmetic chemists themselves. I am very knowledgeable as a hairstylist due to years of education and relentlessly researching cosmetic chemistry. But what I know only begins to scratch the surface of their knowledge. Please share with us any big takeaways you may have had from this episode, along with what topics or questions you would like us to cover next. That's it for today. We'll see you on the next episode.